I wanted to go over a little bit more with you about diet and health, and then talk a little bit about the Healthy People 2020 guidelines and give you some information that you might find interesting in terms of the outcomes of what those are. So when we look at diet and health, and this is just sort of an intro to, again, what we're talking about with nutrition and what we'll go over this semester. If we look at some of the leading causes of death, which is what you have here in Table 1-1, which you also have in your book, the top of the top 10, at least 4 of them are related to nutrition. So heart disease, cancer, strokes, and diabetes. And really what we see with the leading causes of death, they're very related to the influential lifestyle habits, or they're very related to some of the lifestyle habits. So tobacco use, alcohol use, nutritional choices really lead to that. You've probably heard the term that genetics load the gun and lifestyle pulls the trigger. So really, you're born with this set of genetics, and what your parents pass on to you in terms of risks for heart disease or diabetes or cancer, they're definitely there. But whether or not you end up getting those diseases can really be changed based on the lifestyle factors. So there's some good evidence out there that depending on what you do and what you're doing, particularly at a young age, makes a big difference in terms of your outcomes. And this is such an important thing that I will hit on each week this semester probably. I work clinically still, and I see patients, and I can tell you they come in their 60s, some of them late 50s, maybe early 70s. And while people are living longer, they're not living well longer. They're debilitated by their diseases. They're debilitated by the cost, the medical cost, the medicine costs of their diseases. So they've always told me, if there's anything you could say to your students out there, tell them to make sure that they live a healthy lifestyle, because flash of a snap of a finger, you're going to be at this age as well. I know it doesn't feel like it's going to go by that fast, but it will. So what are those lifestyle choices? We can look at diet, tobacco and alcohol use, big problem in this county with substance abuse, physical activity, sleep, stress, and some of the environmental factors. So these are some of the things that kind of play into whether or not we're healthy and can make a difference. So no matter what mom and dad gave you in terms of your genetic potential, you have the ability to really change some of those things. So you're going to read about the Healthy People guidelines. They're listed in this chapter. And the basic premise here of the Healthy People guidelines is the vision there is that we have a society in which all people live long and healthy lives. It always reminds me of Spock, live long and prosper. So someone came up with this guideline. So really what they're looking at is from a public health standpoint, what are things that we can do to really promote this? This is the mission of public health. And so looking at nationwide improvements, increasing public awareness, looking at research, and making sure we tie all this together. So to give you kind of a background on this, they started late 70s, early 80s, then established the first Healthy People guidelines, and every 10 years they're updated. So they come out with a set of goals in terms of what they would like to achieve, and then they measure, did we meet those goals? So you can continue from basically 1979 through 2010. We are now in the 2020 Healthy People campaign, and you'll see that in your book. To give you a little bit more background, basically what they're looking at, they're going to address disease prevention, health promotion. They're going to look at evidence-based guidelines that we talked about earlier, and look at some measurable objectives. So looking every 10 years and what are some objectives that we'd like to achieve. Part of the benefit of the Healthy People movement is that they align a lot of the public health goals. So rather than the federal working on one issue and then the state working on another issue, and our own community public health, county public health working on something else, they align so that everybody's working on the same thing so that we can achieve some of those goals. So some of the key players you have listed here. So you can kind of take a peek at those: state and local health departments, National Center for Health Statistics, federal agencies, Office of Disease Prevention and Health Promotion. So a variety of different government agencies that are working on these to promote health. And if you look at the evolution of them, the number of objectives as you go across each decade has multiplied significantly. So we started off here in 1990, and probably most significant, we were looking at reducing diseases back then, increasing independence for elderly. But as you cruise across here, one of the issues that starts showing up as they're measuring this is there's a huge disparity in terms of ethnic groups and their health outcomes. And our goals are fairly lofty here in 2020 with about 1,200 different measures that they're looking at. So not only are we looking at preventing disease, but we're also really looking at how do we promote healthy lives. And as I told you earlier, my patients come in and they're living longer, but they're not living longer well. And so this is what Healthy People is really kind of focusing in on. So how are we doing with that? And that's a question that always comes to my mind. There's all these initiatives out there in the, so 2010, so some of the smoking initiatives that we had in the late 90s and early 2000s, we had great progress reducing the rates of smoking. I think it's back on the rise again. I think that we have a generation up and coming that are in their late teens and early 20s where we're seeing smoking start to really be an issue. And I wouldn't be surprised come 2020, it's another focus again. So that could be problematic. So how do we do? And I want to give you some idea of what these look like and what the outcomes are. So these are the findings from the 2010 goals. We're now in the midst of the 2020, but they set the goals for 2010, and these are some of the things they looked at. So they looked at adult obesity rates. What you're seeing here are the adult obesity rates in 1988 to 1994, and they're comparing that then to the 2005-2008 data. So these would be the outcomes for the 2010 goals. The dash line across here, this is showing you what their target was in 2000, and this is what we hit. We didn't do very good. I think we did not do very good at all. We've actually increased the rates of obesity. We got nowhere near that line, nor do we even stabilize it. And so who is it that's doing this? Well, in this race, the women outpace the men, so we've got higher rates of obesity in women. So again, here's your target, and as we cruise across time, we see that obesity rates in females has increased. It's increased in males as well. And perhaps they looked at children. Perhaps we're doing better in children because there's a lot of initiatives in children. And again, this is 2005-2008 data, so hopefully as we go to 2020 it'll look better, but we're not doing so well with kids either. So here was our target for children, that less than 5% of our children should be overweight or obese. And here's where we were at in 1988, and here's where we're at in 2008. So, and the rates, as we know, because we hear it on the news every night, are worse today. Childhood obesity rates overall, well, here the men beat the women. I don't know if that's a win, but you have higher rates of male children versus female children. So likely that's going to follow then on into adulthood. So if we get away from obesity and we look at food intake, which, we're kind of looking at nutrition, I'm going to break this down for you. So one of the things we're looking at here are fruit and vegetable intake. So the goal here was that at least, here would be the desired intake, that at least 75%, sorry about that. So that at least 75% of the children were getting 2 servings or more of fruit. And as we look at it, less than 40% or right around 40% of the children were getting 2 servings of fruit. So that's pretty pathetic. They're not, what are they eating? And then when we come down to the vegetable intake, this is pretty pathetic. And actually, I'm sorry, this is for persons age 2 and over. This is throughout adulthood, so not just children. So, and we're looking over here at the vegetable intake. So our goal here was three or more servings, with a third of them dark green or orange. So some of the servings weren't just potatoes. So you had some that were actually had some redeeming value. And the target for the vegetable intake and the grain intake was that 50% of the population. We're looking at less than 5% of the population is having 3 servings of vegetables a day. And then we come down to grains. Not that people aren't eating grains, but what we're really shooting for here is that at least 3 of those servings were whole grains. And again, less than 5% of the population is meeting that. And so my question as I look at this is, what are they eating? They're not eating fruit, they're not eating vegetables, they're not eating whole grains. So what are they eating? And I think I can probably hear your answer now. And we look at the other thing we're concerned about here are the saturated fat intake, total fat intake. Total fat intake is probably going to be gone on the next dietary guide. Actually, I think it is gone on the dietary guidelines. But the focus here again, we see great increases in heart disease with saturated fat. So the target was to reduce saturated fat intake so that 75% of the population was eating less than 10% of their calories from saturated fat. And across the board, less than 40% of us are eating under 10%. So we're not meeting the targets to reduce our rates of heart disease. So we're not even come close. We're at a very low percentage of the population. So as we continue through this semester and we look at some of the issues that face us from a nutrition standpoint, I like to have some of these results out there for you and show this to you because it just stands to reason. If we're eating too much saturated fat, we're not eating fruit, we're not eating vegetables, we're not eating whole grains. What are we eating? What are people eating? You can peek through your book, and these are the targets for 2020. So this is what they've been working on. Probably around 2018, they'll start collecting data to see how they're doing with it, but you can kind of look through this in your book. It has it in there. So as I put these graphs up here and we talk about this, I want you to think about your own dietary intake, and ultimately you will be doing your nutrition diet project to look at how your intake is, but hopefully you're not one of those lower percentages in terms of eating the foods that you're supposed to eat. So we'll leave it there, and I hope you enjoyed the information.